The senator from Nevada.
I ask unanimous consent to speak as if morning business for 10 minutes.
Without objection.
Thank you, Mr. President. Before I begin, I'd like to offer my condolences to my friend and colleague from Oklahoma, Senator Inhofe, and his family on the tragic loss of their son. Both my wife and I will continue to keep their entire family in our thoughts and prayers during this very difficult time. Mr. President, I rise today to talk about the President's broken promises on Obamacare and their effects on the people of Nevada. For more than a month now, the American people have witnessed just how poorly this burdensome law has been implemented. People all over the country are frustrated with the problems plaguing healthcare.gov, as they should be. The government spent hundreds of millions of taxpayers' dollars to overpromise and underdeliver on the signature legislation of this administration. But there are serious problems in addition to the website, and one glaring issue in particular that I would like to focus on today. We've all heard from the law's supporter that Obamacare would give uninsured Americans access to health insurance. Time and time again, they promised that people who already had their health plan could keep it. In fact, President Obama made the exact promise on numerous occasions. In a speech to the American Medical Association in June of 2009, President Obama said this: "No matter how we reform the health care, we will keep this promise to the American people. If you like your doctor, you will be able to keep your doctor, period. If you like your health care plan, you'll be able to keep your health care plan, period." But one of my constituents sent me a letter last week telling me that that wasn't the case. Sonny from Las Vegas area wrote, "I wanted to tell you that we have lost our wonderful health insurance plan." Sonny's family received a letter from their insurance company telling them that their existing plan didn't qualify under the Affordable Care Act. They were automatically reassigned to a new plan that costs about $400 more per month. Let's remember what the President said, this time in August of 2009, during his weekly presidential address about what he called phony claims regarding health reform. If you like your private health insurance plan, you can keep that plan, period. But yet another one of my constituents, Kirk from Northern Nevada, was just notified that his current health insurance had been canceled. He went to the exchange to find a new policy and shared his story with me. And he wrote, "Despite higher deductibles and higher copays, my new insurance under this devastating law will be more than 250% of what I am paying now." And again, March 15th, 2010, just a few days before the law was passed, albeit unread, by a party-line vote and signed into law, President Obama said this: "If you like your plan, you can keep your plan. And if you like your doctor, you can keep your doctor." I wonder how President Obama and the law supporters would explain that statement to Mark in Reno. Mark received a letter telling him that his current plan was no longer offered. The plan, the letter detailed, was canceled in order to, quote unquote, meet the requirements of the new laws. Mark was given the option to keep his plan for one additional year if he accepted a rate increase, even though he just saw a rate increase in September. Mark goes on to tell me, and I quote, "As an individual health care plan holder and a self-employed individual, the ACA appeared to punish me for doing the right thing by having a health care plan for the past 10 years and rewards those who did not," end quote. But yet, as recently as past July, President Obama promised this: "If you already have health care, the only thing this bill does is make sure that it's even more secure and insurance companies can't jerk you around." President Obama made this statement more than 2 years after the administration admitted in comments in the Federal Register that 40 to 67% of existing individual policies would lose their grandfather status. The president knew that millions of Americans stood to lose their existing policies, but he repeatedly told the American public under no uncertain terms that they could keep their plans. I think Stephen from Washoe County would likely take issue with that promise. He told me that he now has health care that costs $293 per month. However, he just received a letter from his health care provider informing him that the cost of his health care would increase to $546 per month on January 1st. That means his health insurance costs will nearly double next year. There's nothing affordable about that. There's nothing secure about that. On September 26th, just days before the exchanges opened to a disastrous rollout, the president repeated yet again what this administration knew wasn't true. The first thing you need to know is this: if you already have health care, you don't have to do anything. Well, I have another letter here from a father from Reno. He writes, "I'm writing to tell you that I'm now eating crow. A few weeks back, I wrote to you and expressed my support for the health reform and my dissatisfaction with the government shutdown. Since then, I've received notification from my insurance company informing me that my current policy is being discontinued. I then began shopping for a new policy for myself and my family and have found that rates are 2 to 3 times what I'm currently paying, and that my max out-of-pocket will double, all for basically the same plan as what I have now. In essence, I've been put into a situation where I can either save for my kids' college education or buy health care." But this particular letter closes with something that really highlights the tough financial decisions facing the American people in these difficult economic times. This father says, "I'm unfortunately one of those people who makes too much money to qualify for federal subsidy, but not enough to sell my house, which is still underwater from the housing crisis of 2008. This is the reality of the health care law. Now, in addition to trying to save for his children's education and attempting to recover from the housing crisis, a father has been forced off the plan he liked, and the options available are 2 or 3 times more expensive." These stories don't fit with the narrative that we've heard for nearly 5 years. Now President Obama is trying to backtrack on the dozens of times he made his promise to the American people. Just last week, he said, "Now, if you have or had one of these plans before the Affordable Act came into law, and you really like that plan, what we said was you can keep it if it hasn't changed since that law passed." Now, that's just not true. That is not what he promised. And now my constituents are receiving cancellation notices for their existing plans. The administration argues that even though many people are losing their existing plans, those plans were subpar policies and their new policies will be better. But that ignores the promise. Mr. President, my constituents liked their plans. They decided what was best for them, what plan fits their individual and family needs. The President and the administration knew before the legislation passed that millions of Americans would lose their current plans. They admitted it in the Federal Register after the bill was signed into law. But the whole time they continued to promote this promise and dismiss any concerns as fear-mongering or phony claims. And that, Mr. President, is unacceptable. These personal stories is why I'm proud to co-sponsor the If You Like Your Health Plan, You Can Keep It Act, introduced by my colleague, Senator Johnson from Wisconsin. This is a simple but necessary bill to give Americans the ability to keep their health plan if they like them. The people of Nevada deserve better, and they deserve to have a government that keeps its promises. Mr. President, I yield the floor, and I suggest the absence of quorum.